Hello lovely people out there, welcome to my YouTube channel and thanks for clicking on this video. In previous video lecture, हमने एक important series of lecture start किया था and the name of that particular series of lecture was Therapeutic Usage of our Alpha Adrenergic Receptor Blocker. In our previous video lecture, our main focus was in the treatment of hypertension. In today's video lecture, we are once again going to continue with the therapeutic usage of our alpha adrenergic receptor blocker. And आज भी हम कुछ ऐसे important clinical conditions देखेंगे जहाँ पे we need to use our alpha adrenergic receptor blocker. So before starting our today's video lecture, let me give you the brief summary of what we are going to discuss in this video lecture. We are going to use the alpha adrenergic receptor blocker in the condition known as benign prostatic hyperplasia. Then the second important concept that we are going to discuss is what do we understand by the dynamic and static component. Then we will see the drugs used in controlling the dynamic and static component. Then we will see the treatment of peripheral vascular disease. And finally, we are going to summarize the treatment of alpha adrenergic receptor blockers. So without wasting any further time, let's get started with the concept of benign prostatic hyperplasia. So as you can see on your screen, on the left side, this is our normal prostate and this is our normal urethra. Now क्या होता है जब patient की age बढ़ती है, this prostate is growing in size. Now जब यह prostate grow होता है, it is growing in outward direction as well as it is growing inwards. So as you can see on your right hand side, this is our enlarged prostate. And हमें ये पता है कि जो हमारे prostatic urethra होते हैं, they are having our alpha 1 adrenergic receptor. So when this our prostates are growing inwards, this alpha 1 adrenergic receptor which is present on our prostatic urethra, they are getting stimulated, or we can say they are getting irritated due to that particular enlargement in our prostate. उसके वजह से क्या होता है? There is further reduction in the diameter of our urethra. Now one of the main important signs and symptoms of benign prostatic hyperplasia is urinary retention. Because जब ये prostate enlarge होते हैं, they are irritating our alpha 1 adrenergic receptor, and हमें ये पता है whenever our alpha 1 adrenergic receptors on our prostatic urethra, they are getting stimulated, it will produce a contraction, and because of that a contraction effect जो resistance provide होता है to our urine outflow वो बढ़ जाता है. So urinary retention is one of the main important signs and symptoms of our BPH. Now moving on to our next important component, that is what do we understand by the term dynamic component and static component. Let's focus on our dynamic component. So dynamic component is nothing but it is related to the smooth muscle tone. Now look here. We have alpha 1 adrenergic receptor present on our prostatic urethra. And this alpha 1 adrenergic receptors are getting stimulated. Now अगर हमें patient को treat करना है, what we can give? We can give those patient alpha 1 adrenergic receptor blocker. उसके वजह से क्या होगा? जो resistance हो रहा था to our urine outflow वो थोड़ा कम हो जाएगा, and जो urinary retention की जो problem थी patient में वो थोड़े हद तक solve हो सकती है. Now why it is known as a dynamic component? Dynamic component अभी हमने देखा कि it is related to our smooth muscle. So यहाँ पे हम क्या कर रहे हैं? We are playing with the diameter of our urethra. And ये जो dynamic component होता है, it is mainly related to our smooth muscle. Now the second important thing that is a common or we can say जो constant है ये पूरे के पूरे condition में, that is enlarged prostate, and this enlarged prostate is our static component. So static component, it is related to the enlarged prostate gland. let's come to the treatment of BPH. For the treatment of a dynamic component, we can use following drugs. We can use drugs like prazosin, doxazocin, alfuzosin and terazosin. ये क्या करते हैं? They are blocking our alpha 1A and they are blocking our alpha 1B adrenergic receptor. Now what is this alpha 1A and alpha 1B adrenergic receptor? So when we discuss the further division of our alpha 1 adrenergic receptor, we can further classify our alpha 1 adrenergic receptor into two main subtypes. The very first one is alpha 1A adrenergic receptor and we have alpha 1B adrenergic receptor. ये जो alpha 1A adrenergic receptor होता है, they are mainly present on our prostatic urethra and ये जो alpha 1B वाला component होता है, that is mainly present on our blood vessel. So by blocking our alpha 1A adrenergic receptor on our prostatic urethra, ये क्या करते हैं? जो resistance to the urine outflow को reduce करेंगे, so the person can easily pass the urine. Now as I told you कि जो urinary retention की problem होती है, that can be considered as a main important sign and symptom of our BPH. So यहाँ पे whenever we are giving or whenever we are treating with the dynamic component of our BPH, we are symptomatically relieving the patient. So ऐसे जो drugs होते हैं which are working on our dynamic component, that is they are working on smooth muscle tone. ये जो drugs होते हैं they are mainly relieving the patient from symptoms or we can say symptomatic relief के लिए we use our dynamic component. Now by blocking alpha 1A, it is a blocking or we can say जो resistance to the urine outflow है वो कम कर रहा है and by blocking our alpha 1B adrenergic receptor, it is treating our hypertension. So as we know कि जो हमारा blood vessel होता है that is having alpha 1 adrenergic receptor and अभी हमने पढ़ा कि ये जो alpha 1 adrenergic receptor होता है which is present on our blood vessel, that is alpha 1B component. So by blocking alpha 1B component, relatively vasodilatation होगा and उसके वजह से जो patient का blood pressure होगा वो कम हो जाएगा. So ऐसे जो drugs होते हैं which can block both, that is alpha 1A as well as alpha 1B adrenergic receptor, they can be given in both the condition, that is BPH की कंडीशन को भी सॉल्व करेंगे as well as it can solve the condition of hypertension. So ऐसे जो ड्रग्स होते हैं ये बहुत ही यूजफुल होते हैं because one drug can treat both the condition, that is BPH and hypertension in the patient. Now one of the important side effect of our alpha adrenergic receptor blocker is first dose phenomenon. What happens in the first dose phenomenon is that the person can develop postural hypotension. Now what is this postural hypotension? Postural hypotension is nothing but जब patient lie down होता है या फिर sitting position पे होता है, जो patient का blood pressure होता है वो normal होगा. But when the patient is taking first time our alpha adrenergic receptor blocker and patient जब खड़ा होता है उसका जो blood pressure है वो कम हो जाता है and this is known as postural hypotension. Now postural hypotension की problem solve करने के लिए we can use two important strategies. The very first strategy is we can give our alpha adrenergic receptor blocker at the bedtime. So जो patient alpha adrenergic receptor blocker लेंगे they will take those alpha adrenergic receptor blocker at the bedtime and they will go to sleep. So जो postural hypotension की problem है वो नहीं देखने मिलेगी. And second strategy जो हम लोग यूज करते हैं that is जो initial dose होता है वो हम लोग small amount में देंगे and जब ये patient लगातार ये alpha adrenergic receptor blocker लेंगे tolerance will be developed. So these two strategies can help us to overcome the problem of postural hypotension. Now just think कि if I am a patient of only and only BPH and मेरे को hypertension की problem नहीं है, if you give me prazosin like drugs, ये drugs क्या करेंगे? जो blood vessel पे अल्फा 1b adrenergic receptor present होते हैं, ये उसको भी block करेंगे. And because of those blockage of our alpha 1b adrenergic receptor on the blood vessel, जो postural hypotension की प्रॉब्लम है या फिर साइड इफेक्ट है वो मेरे में दिखेगा, बट दैट इज टोटली अनवांटेड साइड इफेक्ट. सो हमें ऐसा कोई ड्रग चाहिए विच इज नॉट वर्किंग ऑन अवर अल्फा 1b adrenergic receptor and it is purely targeting our alpha 1a adrenergic receptor. So we have an important drug that is uroselective alpha 1 adrenergic receptor blocker, which is blocking only and only alpha 1a adrenergic receptor, and the name of that particular drug is tamsulosin. So ये जो tamsulosin होता है, it can be given in the patient who is having BPH, but उसका जो blood pressure है वो normal है. Such type of patient जिनका blood pressure normal होता है, they are also known as normotensive patient. Now moving to the next important element, that is a treatment of static component. हमने पढ़ा था कि जो static component होता है, that is mainly related to the size of our prostate gland. Now prostate की growth के लिए there is a very important chemical that is required, and the name of that chemical is dihydrotestosterone. अभी dihydrotestosterone हमारे बॉडी में बनता कैसे है? So we have a testosterone, and testosterone पे एक important enzyme काम करेगा, and the name of that enzyme is 5-alpha reductase. So ये 5-alpha reductase क्या करेगा? It will provide the conversion of testosterone into dihydrotestosterone, and ये जो dihydrotestosterone है, it can be further useful for the growth of our prostate. Now just think कि अगर मेरे को static component को treat करना है, and if I block this particular enzyme that is 5-alpha reductase, so जो conversion of testosterone हो रहा था to dihydrotestosterone वो नहीं हो पाएगा, and relatively जो size of prostate है वो कम होती जाएगी, and the name of that particular drug which is blocking our 5-alpha reductase enzyme is finasteride. So remember, ये जो finasteride होता है, that is useful in the treatment of static component. Now moving to the next important therapeutic application of our alpha adrenergic receptor blocker is in the condition that is known as peripheral vascular disease. Now peripheral vascular disease का one such example is Raynaud's disease. So as you can see on your screen, इसमें क्या होता है? This left side image is showing the normal blood supply. यहाँ पे क्या होता है? In the condition of peripheral vascular disease, जो हमारे peripheral blood vessels होते हैं, they are more prone to vasoconstriction. अगर हमारे peripheral जो blood vessels होते हैं, if they are more prone to vasoconstriction, so जो blood जा रहा था वो properly नहीं जा पाएगा, and the patient can also develop ischemia. So as you can see on your screen, ये जो right side की image है, this blood vessel is getting blocked, and उसके वजह से properly जो blood है वो नहीं पहुंच पा रहा है. So you can see there is a slight blue coloration on our fingers. Now ऐसी प्रॉब्लम को ट्रीट करने के लिए we can use prazosin like drugs. Now why we can use prazosin like drugs in the condition of peripheral vascular disease? हमें ये पता है कि जो हमारा prazosin होता है, that is blocking our alpha 1b adrenergic receptor, and we know कि blood vessel पे whenever we are blocking our alpha 1 adrenergic receptor, relatively it will produce vasodilatory effect. So जो ब्लॉकिंग वाली कंडीशन है या फिर सडन वेजोकंस्ट्रिक्शन वाली कंडीशन है, उसको हम लोग प्रिवेंट कर सकते हैं बाय स्लाइटली डायलेटिंग. सो जो ब्लड है वो प्रॉपरली पहुंच पाएगा. सो प्राजोसिन लाइक ड्रग्स कैन बी useful in the condition of peripheral vascular disease. Now remember, यहाँ पे in the condition of peripheral vascular disease, we cannot give non-selective beta blockers. Now the question is, why we are not giving non-selective beta blockers in the condition of peripheral vascular disease? हमें ये पता है कि जो हमारे blood vessels होते हैं, it is also having beta 2 adrenergic receptor. So when we are giving non-selective beta adrenergic receptor blocker, ये क्या करेंगे? ये बीटा 2 को भी ब्लॉक कर देंगे. बीटा 2 की एक्शन क्या है? Whenever this beta 2 adrenergic receptor on our blood vessel is stimulated, it will produce vasodilatory effect. And अगर हमने इसको ही ब्लॉक कर दिया, there will be more severe vasoconstriction and जो पेशेंट की कंडीशन है वो और भी ज्यादा वर्सन हो सकती है, क्योंकि by blocking our beta 2 adrenergic receptor कोई भी अपोज करने वाला नहीं होगा टू अवर अल्फा 1 एड्रेनर्जिक रिसेप्टर की एक्शन. सो ये जो नॉन सिलेक्टिव बीटा एड्रेनर्जिक रिसेप्टर ब्लॉकर्स होते हैं, दे आर contraindicated in the treatment of peripheral vascular disease. Now finally, we are going to summarize the usage of our alpha adrenergic receptor blockers. Alpha adrenergic receptor blockers can be useful in the condition of pheochromocytoma, and यहाँ पे we are using irreversible alpha adrenergic receptor blocker. These are non-selective in nature, and one such example is phenoxybenzamine. But remember, in the condition of adrenaline producing tumor, ये जो alpha blocker होते हैं, they cannot be given alone. They need to be given in the combination of beta blockers. Now during the surgery, to control the hypertension, we can use intravenous phentolamine. For cheese reaction and for clonidine withdrawal, phentolamine and tolazolone are the drug of choice. For essential hypertension, we mainly use selective alpha 1 adrenergic receptor blocker. And for the condition, आज ही हमने देखा था, that is, alpha blockers can be useful in the condition of BPH. Also, it can be used in the condition of scorpion sting, and it can be used to treat the peripheral vascular disease. So that's it for today's video lecture. अगर आपने वीडियो यहाँ तक देख लिया है, please consider subscribing to my YouTube channel. Press that bell icon. Like this video and share it with your friends. See you in the next video. Till then, see ya, bye bye. Have a good day.